Iron Medical, what's the location of your emergency?
Pinal County with transfer 6597 South Freeway Drive for NFL, collision 1.
Gold Canyon. Yep, there you are. What's going on?
I have a friend here that just arrived, and he was standing outside, and he just collapsed, and he's responsive, breathing, but it kind of looks like a possible stroke.
Can't stick his tongue out.
Can't stick his tongue out.
Okay, about how old is he?
He's 65.
Inside of his face is not responding.
Okay, is it like drooping on one side?
Yes.
Yes, it is.
Okay.
Right side. Right side.
All right, at this time, is he talking to you normal?
Is he talking normal?
No, he's not responding.
No, not
Okay, not responding. All right.
responding,
But he is conscious, though, correct?
He is conscious.
Okay. Has he ever had a stroke before?
No.
No.
Okay, they're coming from the fire house just across the 60 from you. So they're going to be there real soon.
Pardon me?
They're coming from the fire department just across the US 60 from you.
Okay, I'll get the door open.
Alrighty. How's he doing now? Is he still not responsive?
He's still on the ground, yes. He's still on the ground. He just doesn't want to get up.
Hey, you're probably hearing him
He just
by now.
went through it. Pardon me? I hear him.
Yeah.
Here they come. Here they come.
All right, Michael,
Never mind, Dan.
I'll go ahead and let you go.
Okay, thanks a lot.
Okay, you're welcome.
So this particular day, the 911 dispatchers alerted us that we had received a call for a stroke patient. When we arrived to the home, we found that there was a party that was going on outside. They were having a good day. The person just flew in and arrived at his friend's home. They were outside on the patio having drinks. When we arrived, we found him just laying on the ground. He wasn't responding to us, and to us that's not a good sign. So when we found him laying on the ground, we began our assessment. As a crew, we said we will help assess the patient and we'll start some treatments rapidly. So everything happens really quickly. So when he was on the ground, we did a FAST score. A FAST score is something that we're looking for is we want to see facial droop, we want to see arm drift or weakness, we're looking at slurred speech, and we're looking at time. So we evaluate those things quickly so it gives us the ability to say this person is really having a stroke. One of the tools that we have that recently came out just a few years ago, which has made it really good for us to help the hospital and the patient, is we're able to obtain a blood sample. This blood sample is something we hand off right as soon as we get to the door. We give it to the staff, they give it to the lab, we take the patient directly into the CT scanner, and they can start that process to really see what's going on and if there is a bleed or if there's a blockage. This is something that is greatly helping patient outcome, and for us it's very fun because we get to see instantly what's going on and we can watch the scan happen. We can ask the hospital staff what they see, and we can know whether or not we made the right decision to help that person. The outcomes have been tremendously better, and for us that's something that we take great pride in because we want to help the patient. That's our only primary role, is to help people, and we want them to return home and we want them to be healthy. So when we're able to do something better, we appreciate that, and that is something that Mountain Vista's worked great with us to help us do for the patient and for them, and it just gives them the better ability to help people, and that's what we're here for. For us it makes it fun because it's just one more tool that we have and something that we like to do is to help, so we get to do that.
My name is Stephen Russell Waite.
Okay.
And 65. Happened on my birthday, an hour after I landed. And so I was flying the plane, and so we had a beer after we landed, and then got to the guy's house and went to school with, and an hour after we landed, you know, they handed me like $1,000 and 1 cent, and down I went. So, and I remember going, the ambulance, they loaded me into the ambulance, and then, you know, nothing until helicopter ride, and closed my eyes for the helicopter ride, and then nothing after that woke up 2 weeks later, and they got me out of bed and stood me up, and the rest is history.
So, how I like to think of stroke is I think of it as a forest fire. Okay, initially starts off small, only affects a few small trees around that area, but if it's left unattended, that little fire is going to burn down the whole forest in a short amount of time. And once that damage is done, it's irreversible, and there's no going back. So the sooner you can put out that fire with medicine like alteplase, or getting the patient for possible thrombectomy like we did, that extinguishes the fire. So that way we can diminish how many trees or brain cells get burned in that fire, and salvage what's left.
Once Mr. Waite was brought into the hospital with EMS, I went directly to him to see how he was doing. He could follow my commands. He was tracking us with his eyes, but he could not speak at all. His right side was severely paralyzed. He could move a few fingers on the right hand, but he could not move his arm or leg at all. So we knew that this was a severe stroke. Mr. Waite was immediately taken to the CT scanner, where we did a CT without contrast, and then we also did a CT with contrast. His symptoms were very suggestive of having a large vessel occlusion, and so that's something that we want to consider and look for as soon as the patient gets here. We don't do neurovascular at this facility, so it's important that we recognize it early and get the patient transferred out to the definitive center very quickly. After the CT without contrast was done, we also knew that we needed to get alteplase, which is the clot busting medication, started very quickly on Mr. Waite so he could have a successful recovery. I'm very happy to say that as a team we were able to come together and we got that medication started 26 minutes after Mr. Waite got to the hospital. That's very impressive, and I'm very proud of everyone.
Some strokes are very subtle. However, Mr. Waite's stroke symptoms were not subtle. He unfortunately was unable to speak, and he was unable to move the right side of his body. So we were very concerned that this was the devastating stroke that we needed to intervene on right away. Fortunately, part of that equation is getting blood work in a timely fashion, and paramedics came in with a bag of labs that we were able to utilize to get the tests we needed right away. So that shaved 20 to 30 minutes off our times getting the labs back. And when you're talking minutes for stroke care, any time is valuable. So we sent him to the CT scanner to look for any type of bleeding or tumors. That's not a stroke that could cause that. And then we also did some specialized CT scans looking for other types of strokes. We were in the CT scanner within minutes of his arrival. And unfortunately, him being unable to speak, we were totally reliant on the paramedics and the significant other, and they did a fantastic job of getting all the details we needed to make this decision, because unfortunately Mr. Waite wasn't able to help us out. So after discussion with our stroke neurologist here, we went through the entire case. He recommended giving alteplase, which we thought was in his best interest, and we were able to get it into his body within under 25 minutes, I believe 23 minutes, and the recommendation is under 60. So that's the advantage of coming to Mountain Vista, is we're a primary stroke center, and this is what we do. At any time, day or night, we're ready to handle these patients, and we will take care of them, and we have specialty training on how to look for strokes and how to treat them in a timely fashion. So in a timely fashion, that was exactly how a stroke case is supposed to go, from start to finish. There was an amazing amount of teamwork involved. We have an amazing stroke group here that gives all the emergency physicians and nurses training, specialty training. We take stroke now just as serious as any other illness, heart attacks or any types of infection. Stroke care is foremost in our minds.